Well, I have a couple things. The first is I'm the chair for sports safety here in the state, and we canned all our schedule. So last night, one of my radio guys said, "Well, what are you doing? What do you think?" Well, I'm happy to hear that the NCAA has extended their seasons for those kids that are playing that didn't get a chance to play. But they put me on the bench because I'm over 65. My partner says the young guys are going to take this on. So they said, do something else with your time. So that's what I'm doing. So there's some things we're going to learn from this orthopedics. We're going to respond to these situations. And what we want to do is minimize the people going to the emergency room. The most at risk probably patient is the diabetic patient who has 7/10 knee pain, hasn't slept for 2 days. What are you going to do? And you certainly don't want them in the emergency room. And what we've done is we bring them into the office and we want to give them a long-acting triamcinolone, extended release, that it's going to help them. And we're hoping that they're not going to have a reaction to the steroid that's going to prompt them to have to call their family medicine guy or go to the emergency room for a high blood sugar. And we've had a lot of success. And if you look at the literature, certainly we've been fortunate that there's some studies that show that the Zilretta hasn't had the problems that other short-acting steroids have had. But we've looked at we have 66 in our practice, of which we've given bilateral Zilretta injections at the same time with A1Cs of between 6 and 12. And we have not noticed a very large increase. In fact, it's been less than 40, which has been really good. And it responded back within 2 days. No need to go to the emergency room or to see their family doc, and no repeat office exposure. They don't have to come back for 12 weeks. So that's certainly one. And I think that first question that we put up there, we've already answered, which was, if you would put that up for me on the glucose question.
Carolina? Okay.
Well, if we can't go up there,
it'll be up in a second, I'm sure. Oh, so
the other thing, Rob, is if they went to the emergency room expecting a shot for that 7/10 pain that they didn't sleep for, at least in Delaware, they're not going to get a shot. Our docs don't stock the drugs and aren't willing to really give it. So they're going to end up having the pain anyway. So you should keep your office open if you can. And we'll discuss that with my third topic. So let's just move on to the answer to that one is true. Okay, and we can move on to the next question here.
Okay.
So could I have my next question, please? This is the second candidate. Delaying surgery isn't new. Those of us that have patients that are big uns, that are over that 49 BMI, they can't have surgery or shouldn't have surgery because their incidence of problems goes way up in the complications. So we've been practicing this technique of delaying surgery for a while. So we probably should draw from those things that we've been doing. And I don't know if the question will come up, if it comes up, but if you have a BMI of 49, the likelihood of you being under 45, which is what we're searching for, at least the minimum of 45, is going to be 1% per month or 4 months. Well, gosh, put 4 months of Zilretta's action together with the 4 months that you need to delay surgery anyway. Use those techniques that we've had in the past, and I'm going to offer to you that, listen, you need to do that, and it will really allow you to move forward with a very reliable state, and you'll feel like you can do that. And being a physical therapy professor, we tend to like a prehab program. It gives you time to get strong. So while you're waiting to have your surgery, I encourage you to get on your exercise program and use these 3 to 4 months that your surgery was delayed to do something productive. So that's my rehab spot. The last one is, how do we keep our office open? Boy, all of us felt really relieved when JBJS came out with the Singapore experience and the CDC. And our office has been able to really move forward with a program that we chose our largest office. It has 3 6-patient room availabilities. We rotate our staff. We wear masks and gloves. We schedule our people a little lighter so that no one is sitting in the waiting room. We have the waiting room marked off so that you have 6 feet between you and the next chair. which is what we wanted to do. But what we've really done is we have the people wait in the car and we call them in when it's their turn for their appointment. They can bring one loved one in, and that has really been helpful. Now, after this is all done, we have the first responders prioritized program that we began in our office, which is basically those people that are first responders, policemen, firemen, healthcare workers, those essential workers that we see as demarcated by the government, that these are essential. We have them at the top of the list, ready to go. Why? Because they got to heal and recover. And these are the guys that are going to be backing up. They're the reserves to the people that are working currently. So we would offer to others, consider those people, put them at the top of your list and operate whenever you can to get them ready, because that is the second team that needs to be the first team. That's all I got.